Let's talk about diabetes, or sugar, as some may call it. According to the Centers for Disease Control and Prevention, CDC, diabetes is a chronic or long lasting health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar or glucose and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. There are two types of diabetes, type 1 and type 2. Type 1 was once known as juvenile onset diabetes, and just as the name suggests, it is a type of diabetes often diagnosed in childhood, but it occurs at every age. In type 2 diabetes, the body does not produce insulin at all. With the help of insulin therapy and other treatments, you can learn to manage the condition and live a long, healthy life. Remember, this is a condition that can be managed, again, by living a healthy lifestyle filled with exercise and a proper diet. You can live a normal life and do everything you set out to do. The other type is type 2, but often people are told they have prediabetes before getting a diagnosis of type 2. There are no clear symptoms of prediabetes, and you may have it and not know it. But before people develop type 2 diabetes, they almost always have prediabetes, where blood sugar or glucose levels are higher than normal, but not yet high enough to be diagnosed as diabetes. It's possible that you may have some of the symptoms of diabetes or even some of the complications. If you think you may have diabetes or prediabetes, check with your doctor and get tested. If you discover that you do have prediabetes, remember, it doesn't mean that you'll develop type 2, particularly if you follow a treatment plan and make changes to your lifestyle through food choices and physical activity. Even small changes can have a huge impact on delaying or preventing diabetes altogether. Work with a healthcare professional to make a plan that works for your lifestyle, or look for a CDC recognized lifestyle change program guided by a lifestyle coach trained to use an approved curriculum, where you will meet other people who are working to prevent diabetes. As a matter of fact, I, along with several other health professionals in the community, are being trained as coaches using that curriculum at the end of this month. Stay tuned for more information on that. That brings us to type 2, which was once known as adult onset diabetes. With type 2 diabetes, your body does not make enough insulin or cannot use it as well as it should. When there's not enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, diabetes can cause serious health problems such as heart disease, vision loss, and kidney disease. There is not a cure yet for diabetes, but losing weight, eating healthy food, and being active can really help. Other things you can do to help your diabetes include taking medication as prescribed, receiving diabetes self-management education as mentioned earlier, support, and being consistent with your medical appointments. How does diabetes affect the African American population? Well, in 2019, non-Hispanic blacks were twice as likely as non-Hispanic whites to die from diabetes. In 2018, African American adults were 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician. In 2019, non-Hispanic blacks were 2.5 times likely to be hospitalized with diabetes and associated long-term complications than non-Hispanic whites. In 2019, non-Hispanic blacks were 3.2 times more likely to be diagnosed with end-stage renal disease as compared to non-Hispanic whites. If you have any questions regarding the information I have shared, feel free to contact me, Dawn Daly-Mack, RN, at 252-410-1717. Remember, with some work on your part, diabetes can be controlled. But always remember, Black health matters.